Okay, never mind my lawn. I have the worst mowed lawn on the block, and it's embarrassing. So I can't pull the cord on the lawnmower, and I can't manage mowing that much. So it's yeah, it's not working. Last year I was able to mow my lawn a couple of times because I let my chest heal and last summer, and because I didn't have that surgery until August, so I just needed help in these last months, and it got colder a lot faster last year, I think. Anyway, so today I want to just show a little tip here. Let's hope my phone doesn't fall over. It's gonna be crooked. Oh. I've been watching all this stuff on creating videos, and I should do a better job. And it's starting to get a little rainy out here, it seems. Anyway, so these these waist leashes here. So come here, Diane. These are really good to use if you have dogs and you need to walk them. If you've had mastectomies, gone through breast reconstruction, you're healing. So they just go around your waist, they click in. So I guess this is my 2-minute tip. If you're going to go through surgeries like this, and you are an active person, come on, Jack, come here. Good dogs. And come here. You're going to want a good way to balance the dogs. And then I also use a pinchy collar on Diane because she pulls. Jack is trained good enough. He's almost 9 years old. It is raining a little bit out here, but I don't care. I want to get this walk in. I'm all jazzed up from this morning, from just feeling better about my cancer journey. So absolutely. And I think that feeling better about it is going to help me heal physically, emotionally, spiritually. You know, I just had this talk with my care provider. Oh, I got a big fuzz on my glove about this morning. And then the other thing I'm thinking about is we talked about lymphedema, and I'm fortunate a lot of breast cancer patients will have some sort of lymphedema, and that makes it difficult. That lymphedema is swelling of the extremities, especially like in your arm where you had lymph nodes removed. I did have the sentinel node removed. That was my saving grace with this cancer, is that it stayed out of my lymph nodes. We prayed so hard for that. Lots of shout outs to all the prayer warriors and the big guy for listening, because you know, what we needed most and prayed for most happened. So yeah, I remain hopeful and faithful despite no matter what goes on. And thinking about the arm thing, I get neuropathy. I have neuropathy, and my arm will tingle. I'll be cold faster, so I always like to dress in layers. Like right now I have a t-shirt, 2 sweatshirts on, and a raincoat. So gloves. And I know it's only like 64 degrees out, but if you suffer from like neuropathy, my fingertips hurt, and I'm no doctor or expert or no, I just know what works for me. But having a lightweight pair of gloves to wear on my fingers really helps. I'm dressing in layers, so reduces the tingly or the feeling of that bizarre feeling. And you know, so put a thumbs up in the comments if you know what I'm talking about, with the where your fingertips, you can't feel them, but they hurt. And it's the most bizarre sensation that I've experienced. So yeah, anyway, I am just taking the pooches for it's hard to point backwards. I couldn't be a weather person. Jack, Diane, and we're just out getting a walk. So I'm trying to work on that pre-type 2 diabetes condition. I don't know if the chemo kicked that in or what, that happens. So, my doctor actually told me to be proud of myself so that I can walk 6 blocks. It's taken me, you know, all summer since May to be able to do this. just to walk 6 blocks. And she said, you know, maybe in another year it'll be 7 blocks, and that's okay. Because also I'm contending with the chronic pain, the chronic migraines. I've been on this battle for a lot of years. And I have to realize all of that happened to my body. And there's often that false expectation that the surgery is done, you know, the wounds have healed. There's just scars left behind that, you know, you should feel all right and be okay because you look physically okay. And I was reminded today by the doctor that that's not the way it is. And I'm like, geez, but some people can run marathons like 6 months after they're done with their surgeries. But that wasn't my case. And so at my own pace, just like you'll go at your own pace, and I have to do acceptance. I talked about acceptance yesterday. So accept. And yes, acceptance. And just one step at a time and do what I can. And I'm not 20 any longer. But I am not going to give up. I still want to be in the best shape as I can. And just because I can't run marathons yet, doesn't mean that I have to feel defeated. It means that I just have to be motivated, stick to my star chart, that I check exercise every day. So the star chart thing is working well, rewarding myself for simple things like getting up, doing my physical therapy, showering, making coffee. I even put on there because making coffee is, to me, a sign of how good my mental health is doing. And I think I need to also have a category in there, enjoying music appreciation. So I should be finding more joy in everyday life. And I have not been grasping at that. I have been focusing and fixating on the negatives and the what I've lost and all that, you know, it's all about me, you know, and woe is me and X, Y, and Z. And I'm just so engulfed in it. And I have been for so many years. But it's time to look at it differently because I have a lot of great support all around me and people that are helping me and loving on me and making things good and right. And I could not do this without them. Bona fide 100%. I couldn't. I literally would be homeless in a box on the street. I'm pretty certain. If not for them. And because of these two, they get me out to walk and help me get my exercise because I feel guilty if I don't. And then I think about it and then it bothers me and it causes me stress. So, and right now I'm trying to respond to with those things with acceptance, but I'm trying to also respond with if I feel anxiety over something, like what do I do to tackle it and actually get at that root cause of the anxiety? Like, what do I do? And that usually means taking action. It is taking action, whether it's making the phone call, sending the email, filling out the paperwork, walking the dogs. Look at Jack and Diane. Yes, like the John Mellencamp song. And that helps. So anyway, with the dogs, I get this anxious feeling, and I know I'm feeling their anxious energy because they want to get out and about, and I don't have I live in town, so I don't have a property they can roam any longer, and I don't have a fenced-in yard. So, but I believe and I receive. I believe that I will be a homeowner once again. So, all right, we are just out doing our walk, and I got the dogs here, Jack and Diane. So, and I can walk 6 blocks And I should be proud of it, my doctor says, instead of being ashamed that all I can walk is 6 blocks. Because we see scars healed. We're done with our chemotherapy. We're done with our radiation, our immunotherapies. And, we look like our old selves again. But we're not our old selves. And it takes time to build back, and everybody does it at their own pace. And so here I am doing it at mine. And it feels really weird going from a person who used to be really, really super active, who used to do an hour of yoga a day, an hour on the treadmill a day, walk the dog, and work 12 to 16 hour days a lot. Plus, I'm getting older too. So it's weird for me to be in this spot. All right, that's it. I'm just talking about walking and getting her done. Bye, everybody.